Hello, my name is Dr. Niranjan Hiremath. I'm a senior consultant cardiac and aortic surgeon at Indraprastha Apollo, New Delhi. When it comes to doctor-patient relationships, if we all remember going back about 20, 30 years ago, right when our parents or our grandparents used to go to their doctors, there was always this element of trust in every doctor they used to go. Even if the doctor was just a general physician or a specialist, once that doctor-patient relationship was built, he would be the go-to person for any kind of ailments, be it for the person himself or for his family members or extended family members. In those days, the doctors also used to spend a lot of time with the patients explaining every single nuances and not rushing through a consultation with the patient. But of late, with the advent of a fast life, fast food, hence fast information, everything has become fast paced. The doctors are in a rush, the patients are in a rush. There are a lot of shortcuts being taken in terms of spread of information. There's a lot of misinformation being spread online. You have Google, you have WhatsApp, but none of them are credible sources of information. So that has led to the patients not trusting the doctors enough, the lack of communication in a period where actually communication is the highlight of today's generation. So it is very important for us as doctors to remember and that clear communication, transparency in providing the right facts, evidence-based facts that are being practiced worldwide be communicated with the patient and the family very well. There are so many new advances in the medical field. Every day there is something new that's coming out in the advancement of the medical field that one, the doctor has to be updated with, and second, that needs to be communicated clearly to the patient. It is also important to realize that for a patient, it is a once in a lifetime event or a once in a lifetime opportunity to meet the doctor and to understand about his diseases and the treatment options available. For a doctor, it may be a day-to-day business. For a doctor, it may be just another day at his workplace. But for a patient, it's a once in a lifetime event. Hence, it is very important to understand from the patient's perspective as to what they expect from a doctor, and that is how you build a relationship and the trust with the patient. See, in today's world, social media is a great tool for keeping updated about one's ideas and opinions. But what happens is there is too much of misinformation being spread as well. The more you consume misinformation, the more it's going to be fed to you. So you have to have your facts right. It's not that you should not consume social media. It's not that you should not read about these things. If you read and you have certain doubts, or if you think that you have an information that maybe needs to be communicated with the doctor, it's important, even if you read about these things, to ask your doctor that, look, these are the things that I've read on the internet. Are these true or not? Instead of blindly trusting everything that you see and read, because any kind of over information or misinformation can be potentially dangerous to your life. So it's important to choose the right path and the right mode of information that you consume. See, when a patient comes to a doctor, it's important to spend time listening to the patient and also keep him informed about shared decision making. This is where the doctor puts facts in front of the patient about the benefits of the so-called procedure or the surgery that the doctor is about to perform, and also the risks of the above said procedures. What happens is when we do not clearly communicate with the patient or his family about these things, the patient is left in the oblivion about information and goes back to internet or Google to get his remnant answers. Unfortunately, online there is a lot of information, much more than what a common man should consume. There are huge laundry lists of symptoms, laundry lists of treatment options available, and laundry lists of complications, but they may not be true in every sense and every case. Hence, it is important to sit down with the doctor and the doctor to listen to the patient ask all the relevant questions, keeping in mind that the doctor is a very busy person and relevant information only should be sought from the doctor rather than asking all of the kinds of information. And it is important to have an environment where the decision is eventually taken by the patient from the recommendation by the doctor, and that is how ideally a decision should be arrived at. How do we go about the current discrepancy in communication is that we need to make sure that one, frequency of communication should be on point. The communication should be on daily basis at the minimum with the patient family. Sit down in a comfortable environment, pass on all the information to them and allow them enough time to ask you questions. And also you have to make sure that whatever you inform the patient should be with utmost honesty and transparency. So this is a model of the heart that I commonly use to communicate with my patients to explain about their heart problems. It is, if you come to a doctor's office, it's important for the doctor to spend some time, show what exactly the patient is suffering with and what the doctor needs to deal with. And this helps give the patient a clearer picture about the problems he has. Now, for example, this is a model of the heart that can be opened and the internals of the heart can be shown in a very clear and a crisp manner. And what this does is the patient understands better. He has a 3D orientation of what's actually happening and what the doctor needs to be dealt with, instead of just a doctor saying, look, I just need to change your valve. Now, which valve do we need to change and why we need to change and what is the function of that valve? These are the kind of information that a doctor can provide with these kind of models. So I have numerous ways of showing a patient as to what could be wrong, and one being this heart model that I carry with wherever I go.